We get to use contemporary best research with patients, and we can really help people who may be in a quandary, wanting to know whether they need urgent surgery, whether they can delay that and opt for more of a less invasive and conservative approach with physiotherapy. And that's probably one of the best things, is seeing people come out the other side of their pain and injury and see them get back to their best quality of life. Hi, my name's Dr. Kieran Richardson. I'm a specialist physiotherapist and I'm the director of Global Specialist Physiotherapy. So I run a consultancy company of educators, researchers and academics, and we train people within the allied health industry as well as some medical practitioners, and we also give second opinions to patients, and that is delivered both face-to-face and online through various platforms.
Here's another case of a complete ACL rupture that had success, this time without bracing. The patient underwent a rehabilitation protocol. Initially, their tibia had slid forward, so they had anterior tibial translation. Their follow-up MRI showed an excellent healing, continuity of the ligament. We can see that that tibia had shifted backward into its more normal position, and there was excellent girth in the ligament.
I'm based in Perth, Western Australia, and some key turning points in my career were certainly completing postgraduate master's degree at Curtin University. That was in 2012, and then completing my doctorate level fellowship at the Australian College of Physiotherapists through the Australian Physio Association, and that was in 2016. They've been very pivotal in my career, and there's been, especially in the past 5 years, really since COVID, transitioning away from doing primarily face-to-face treatment and education, more towards online delivery, both of mentoring via platforms like Zoom and running education and speaking at conferences via Zoom, but also seeing patients both locally here in Australia and around the world. I think as a specialist physiotherapist, it's pretty exciting because we get to use contemporary best research with patients, and we can really help people who may be in a quandary, wanting to know whether they need urgent surgery, whether they can delay that and opt for more of a less invasive and conservative approach with physiotherapy. And that's probably one of the best things, is seeing people come out the other side of their pain and injury and see them get back to their best quality of life. Something I found rewarding was a large corporate entity. I managed to go over to the other side of Australia, so being based in Perth, Western Australia, going over to Melbourne for a week and training a large group of physiotherapists in hands-on techniques. I really enjoyed doing workshop style training. That was something I found very enjoyable. I'm also a part of a research team looking into ACL injuries, how they're managed, and then specifically, can we get ACL tears to heal without surgery? That's been particularly exciting. We're seeing a number of different trends within our sector. Obviously, we're based in my home right now, and so as someone who runs a lot of telehealth consultations a week, since COVID, that's been a big shift that has changed, where patients may not necessarily need to come into the clinic to have reviews of their exercises. They may even want a second opinion, an initial consultation, all conducted via video. That's been a big change for me as someone who used to do 3 or 4 days a week in person, now doing 3 or 4 days a week online. That's a big shift. And so that, I think, has been disruptive, but I think also really good for patients as well. I really think you have to be committed to the long game if you want to work within the physiotherapy sector. There is some research that suggests that physiotherapists can start to burn out within a few years. And I think I haven't had that experience, probably because I've been looking at my career over a longer span of time. I'm 20 years in, and I think it's a lot more flexible now, the opportunities to upskill. So if you wanted to do postgraduate studies, there's various modes of delivery you can have, online as well as in person. I think that makes it a lot easier for people who want to continue to work full time, and so I think that makes it probably exciting to upskill into more of an expert clinician role. So you don't have to necessarily just stop working. You can actually continue to work essentially full time and then study part time or semi part time. Look, outside of work, I've got a young family and we really love traveling. We live really close to the beach here, so we enjoy going down and even through winter here in Perth, the beaches are nice. So we enjoy getting down there and getting amongst the waves. And although people might think there's a lot of sharks here, there's hardly any. So yeah, we love it. And I guess, yeah, just enjoying nature and playing sports and keeping fit and having fun with my family.